All right, let's talk about some of the neat technology that we have here in our practice. One of the most fun things, which we've had for several years now, is the CEREC one-visit crown machine. We were the first people in Port Orange to have this machine, and it allows us to avoid that second visit that is always a big time burner for our patients to have to kill a whole day to come in here and get the crowns delivered. In addition, in a normal procedure when you're making a crown, you have to wear a temporary crown, which is a big pain in the butt because then you have to, you have this rough temporary that sometimes comes out and it doesn't quite feel right, and there's a lot of things that are not so much fun about temporary crowns. So if we can avoid doing that, then it's a big win for our patients. Now, to do that we have to use some pretty neat technology. We have a machine here behind us which is a combination CAD/CAM design machine, which is kind of standard technology, nothing really too special about that, coupled with a very cool laser scanner which scans the tooth to a very high degree of accuracy and allows us to make a three-dimensional model of the tooth. Once we design it on this, we take it over to a milling machine where it takes a block of porcelain and converts the design that we've made into a crown. So let me just show you a little bit about the program, and we'll show you what we have to work with here. Okay, so this is an example of a tooth we've actually worked on. You can see the crown that we've designed, that's the white part, and you can see the three-dimensional model that we've created. We'll make that crown disappear here, and you can see the prepared tooth is right there. We can place the crown back on, and this allows us to look at this in a transparent fashion. As we're designing the crown, we can make sure it's not too thick or not too thin. And if there's anything we don't like about the crown, we can just change it. For example, if we think that that cusp is a little too pointed, rather than wait until the patient sees it, we can just kind of melt it down here. Let's get this melting function over here. We'll melt that. See that tip just melting off and rounding off. So we could do any kind of changes we want to prior to fabrication. And once it is fabricated, once we've designed it, we can then, well, that cusp is a little bit high. Let's just round that off there. Once we've designed it, then we will take it to our little robot milling machine and convert that design into reality. Okay, so now we've designed it on the computer and we want to turn it into reality. So what you need basically is a three-dimensional printer. It's like on your home computer, if you've created a nice photograph, you send it out onto the printer. Here we have to turn that design into porcelain. So to do that, we have a machine here that has two little robot-controlled drilling units, and it is controlled by the computer, and it turns this block of porcelain, of which we have many different colors and translucencies, into a crown. So let's zoom in a little bit here so we can see this. Okay, so this is a typical block. We have blocks that have multiple layers of color because natural teeth have multiple layers of color in them as well. So this makes for very realistic crowns. It's also made in a laboratory where it's very flaw-free, unlike handmade crowns where there can be porosities and little flaws in it. This is totally a perfect block of porcelain, flawless, like a diamond. So we're going to take that and turn it into this. And this is a crown that we fabricated. You can see the hollowed out inside portion. This has been polished up, but it comes off of, this is the residual block. It just kind of gets attached to that, and we take it off, try it in, and cement it, and you're all done. So that's what you can achieve with a CEREC crown. Very cool technology, very convenient for our patients. Thank you.